When should you get your first breast cancer mammogram? When is the right time to get your first breast cancer mammogram? This is a common question many people have, and it is essential to understand the guidelines to make informed decisions. For individuals at average risk of breast cancer, major medical organizations recommend starting screening mammography at age 40. This guidance comes from respected groups such as the American College of Obstetricians and Gynecologists, the American College of Radiology, the Society of Breast Imaging, and the U.S. Preventive Services Task Force. Once you start screening, it is generally advised to have a mammogram every 1 or 2 years. The exact frequency can depend on individual risk factors and should be discussed with your healthcare provider. The American Cancer Society offers additional guidance, suggesting that women aged 40 to 44 should have the option to begin annual mammograms if they wish. For those aged 45 to 54, routine annual screening is strongly recommended. After age 55, women can continue annual screenings or switch to biennial screenings, as long as their overall health allows for a life expectancy of at least 10 more years. Now, what if you have a higher risk of breast cancer? This includes individuals with a family history of the disease, particularly if a first-degree relative was diagnosed before age 50, or if there are known genetic mutations like BRCA1 or BRCA2. In these cases, screening may start earlier, often around age 30 or about 10 years before the age at which the youngest affected relative was diagnosed. This earlier screening is crucial for improving early detection in higher risk groups, but it is vital to personalize this approach with your healthcare provider. In summary, the timing of your first mammogram largely depends on your risk level. If you are at average risk, begin screening at age 40. If you have increased risk factors, consider starting earlier, typically around age 30 or 10 years before the youngest affected relative's diagnosis. Always engage in informed discussions with your healthcare provider to determine the best screening plan tailored to your personal health needs. Remember, early detection can make a significant difference in breast cancer outcomes, so staying informed and proactive is key.